Good afternoon, everyone. Welcome to today's webinar, which is presented on part of Lutronic's virtual workshop series. Today, we're very fortunate to have Dr. Vic Ross with us. Dr. Ross is the director of the Laser and Cosmetic Dermatology Center at Scripps Clinic in San Diego. He is past president of the ASLMS and has served on the boards of the American Society of Lasers and Medicine and Surgery, the American Society for Dermatologic Surgery, and the American Society for Cosmetic Dermatology and Aesthetic Surgery. He's the author of over 100 articles and 9 book chapters and is recognized worldwide as a leader in energy-based devices for derm and aesthetic skincare. So we're delighted to have Dr. Ross with us today. He's going to talk a little bit about his holistic approach to treating patients in his practice. Welcome, Dr. Ross, and please take it away.
Well, thank you, Paul. So we're going to talk about 2 systems made by Lutronic today. And one of the things you have to remember is that when you're trying to devise a therapeutic program for a patient, first thing you have to do is decide why they're there. And if you see on this slide, every patient is different, which is true. We have different races, creeds, colors, sizes, shapes. But certainly, particularly for the face and neck, we have different presentations. The main thing people come in with oftentimes is a loss of tone and texture of the skin, and we'll show a slide later which really represents what I think is the most common thing that women, say age 40 to 60, complain about, and men too, which is this early jowling of the face, particularly when they bring their chin toward their chest. We'll show a video of that. But aesthetic concerns are different, and the recovery process is different. And what you want to do is take all the tools you have. We have lots of expensive tools in our laser energy-based toolbox, whether it's radio frequency, intense pulse light, or laser, and bring those together in a way that maximizes the outcome and minimizes the downtime. And in the end, that makes for happier patients. So you don't necessarily have to stick to one brand of equipment or one type of equipment, but you want to try to generate the best menu for your patient to get the best results. Just like at a restaurant, you want to get that meal that's going to make patients the happiest, or the meal goer the happiness. So the first device that we'll mention later, the first one we'll show in this slide, is called the Genius. And the Genius is a radio frequency needling device where small needles are inserted into the skin and retracted. And the idea here is to invest heat into the skin at a predetermined depth, which we'll show later, to really build up the foundation of the skin. So this is really the deep part of the house. If you use a house as sort of a model of what you're trying to do, this is the underpinnings of the house, the foundation. You're trying to firm it up. You're trying to tighten it up in a way that's minimally invasive and maximally effective with the least number of treatments. So that's one of the things we're going to talk about. And the second part is the Ultra, which is Lutronic's new semi-ablative, non-ablative, 1927 nanometer fractional laser. And this really helps to kind of homogenize and sort of wax on, wax off, kind of paint the house. So it takes those irregularities of the skin, fine lines, and mainly pigment inhomogeneities, in other words, the mottled pigment, and try to demodelize it and make it more one color. Because one of the things when you look at somebody and assess their age, oftentimes not consciously, you're looking at mottled skin. And you can take even a 12-year-old boy who's probably the least astute at picking ages, and they can tell the age of somebody from 40 to 25, oftentimes just by looking at fine lines and mottled pigment. And the Ultra really focuses on those 2 things, the very fine lines and the pigment, again, which is the paint. So when you take these 2 devices together, the painting device, the Ultra, and the Genius, which firms up the skin, you have a nice 1-2 punch and a knockout against wrinkles and pigment disturbances. So every time you treat a patient with any type of device, you should be thinking in terms of what am I doing to the skin on a microscopic level immediately, and what's the consequence of that over the short and long-term haul. So when you, for example, use the Ultra device, you're really treating, and we'll show histology, the superficial 100 or 200 microns of the skin, which gets you down into the dermis, which is really the part of the skin that gives the skin its turgor and its firmness. And then the epidermis is where the pigment problems are. So the pigment problems are largely reversed by the Ultra. So again, you got this 1-2 punch, and you want to tailor the therapy to address the pathology. And that's the real goal here, is to make sure you titrate the treatment for what the patient presents with. So that's the TotalSkin solutions. We're talking about combining that radio frequency microneedling device, the Genius, with the Ultra, which again is this fractional 1927 nanometer laser, which is relatively superficial. And that way we can treat all the layers of the skin effectively and safely. And really hit the three things that most people care about: tone, texture, and pigment. So these are the things we want to do: lift, tighten, reduce wrinkles, improve that tone, texture, and pigment. Those are the fundamental issues with most people that makes them look older. And it's not always obvious, but the eyeball can process a lot of things, and it becomes more likely that most people can guess how old you are if you don't have the Genius or Ultra treatment done. So beautifying, clarifying, renewing. You can always add other things. So when I treat a patient, I'm like that cook on Hell's Kitchen or like one of these British cooking shows, the pastry shows. You're really trying to take all the weapons you have, like Batman with his utility belt. You want to bring the things that work. So, for example, if somebody has a deep fold along their mesolabial area, their marionette line, no amount of Genius or Ultra is going to really reverse that to the point where you probably want it to. But if you add some filler there and you relax some lines on the upper face with a neuromodulator, one of the 4 that are available now, you can actually have a nice kind of combination approach, and there's some synergy between these different products. Oftentimes we'll do all of those at the same time. So let's start with the Ultra, which is the 1927 nanometer fractional thulium laser. It's been on the market for just a few months. There was a previous version which was pre-Ultra, and that was the Laze MD. The Ultra is a more powerful version, a more sophisticated graphical user interface, easier to roll around, easier to navigate, and really a lot more power. That's the main thing. It also has 2 spot sizes, micro spot sizes, 200 microns and 350 microns. A nice beam profile for the micro spots, and it's powerful enough to cover the skin with reasonable coverage rates with a minimal amount of time. So you can set it in a rolling mode, and there also is a static mode, which will show you where you actually just stamp. But it's a very versatile device because there are lots of different modes. And again, the new graphical user interface makes it easy to choose the right settings to have the best results with the least downtime. One of the things people are always a little bit challenged with is why this wavelength. This is a graph that shows wavelength on the x-axis and the relative water absorption on the y-axis. And these different peaks that you see are important, and if we'll move from left to right. If you move around 1400 nanometers, 1500 nanometers, those are your classic non-ablative wavelengths, and those were the original wavelengths that were deployed in fractional lasers. These devices are nice in the sense that there's no downtime other than some swelling. There's no real crusting, and they've been effective for acne scars and other types of interventions. The one thing that is not so good about them, they do very little for pigment without a lot of treatments because the coverage rates are very small, and the pain can be quite significant as well. And then you go to erbium YAG a little bit to your right, and the absorption is so strong that you get this very violent vaporization of the skin, and it actually blows the top of the skin off so you have an open wound. Now you can turn it down, and an ablative fractional erbium laser, erbium YAG, can be not so rough, but most people, to get good results, you have to have some pinpoint bleeding and oftentimes a little bit prolonged recovery. The thulium is a sweet spot. So if you look at it, it sits right between that peak water absorption at 2940 and that very low water absorption at 1440 and 1540. So it's sort of a hybrid laser in the sense that it sticks right in that little gap. And that's a nice place to be because you get enough heating to cause some very mild coagulation, which causes some remodeling, but not so much vaporization that you have an open wound. So it's a nice sweet spot where you get a lot of coverage with very few passes, and it's really uniquely suited for pigment and fine lines. And I'd say pigment is really its forte. It's probably the #1 laser for rehabilitating the skin from a pigment standpoint with minimal downtime and minimal risk of post-inflammatory hyperpigmentation. This next slide is important because it shows the 4 major players as far as wavelengths in the fractional game, so to speak. So if you look at the Ultra, you see it's coagulating down a few hundred microns, and the width is a few hundred microns depending on what size you use as far as the micro spot size. But it's a nice sweet spot because you don't get the hole in the skin, but you get enough coagulation to get some remodeling, and you get that epidermal disruption to have a nice, happy, fresh epidermis. Because one thing people like, they like fresh, very light pink skin. And what this device allows you to do is have this very gentle recovery where you get a remodeling and pigment improvement all at the same time, typically within 5 to 7 days, but no open wound. I would say 1927 nanometer laser is really the best laser with the best results with the least downtime because it's short or south of an open wound. So your next step would be to do, again, a fractional CO2 laser, an aggressive fractional erbium laser, but you have more downtime. Now, if you look to your right, you have the traditional fractional non-ablative laser, which is 1540 or 1550 nanometers. And the reason it's non-ablative is because the absorption by water is much less than at 1927. And so what happens is rather than ablation, you get coagulation. And again, this is nice because there's no open wound, there's no crusting, and it can do some good work for wrinkles and acne scars. But the results are oftentimes very modest because without doing something else, for example, like intense pulse light or pulse dye laser or maybe large pulse KTP laser at the same time, you leave a lot on the table. In other words, if somebody comes with a big brown spot, this is not going to do much for that. If you move to the right, you have fractional erbium YAG, which is a very ablative laser. You almost always have at least some crusting. But if you go deep enough to have things that really happen, you're almost always going to have a little bit of pinpoint bleeding and sometimes a little prolonged recovery. And then finally, to the far right, we have CO2 fractional, which unless you use very, very, very gentle settings, is almost always going to have a downtime of 5 to 7 to 10 days. So when you ratchet all this back and forth from left to right, 1927 nanometers represents a real ideal wavelength for getting maximal returns on your downtime investment. So why is Ultra best-in-class resurfacing solution? Again, you get this global improvement. Stubborn pigment, I think it's the #1 application, tone, texture. It's reasonably comfortable. There is some discomfort, but with numbing cream and cold air, people tolerate it very well. It's safe on all skin types. Very delegatable because it has a very sophisticated scanning mechanism, which is very nice at counting how many joules you're delivering. The consumables are very low cost, and the downtime is relatively short, and the procedure is short. And there are some masks and serums that can be accompanying the device to make it even a more pleasant, rewarding experience. So thulium, again, is non-ablative, really nice because you can ratchet it down. You can have a 2 or 3 day recovery if you want to do something very light, or you can ramp it up to 4 to 5 to 6 days if you want a little bit more pigment improvement with one treatment. I like to do one treatment and do another treatment much later. You can certainly do it that way, or you can do a series of treatments 3 or 4 weeks apart with lower settings. It really depends on the individual needs of the patient. But this particular wavelength is cleared for actinic keratosis, benign pigmented lesions, and skin rejuvenation. It has a magnetic roller tracking system, so the device rolls back and forth, and when it's red, it's in a good speed. It turns purple when you go too fast, and then blue it's in standby. So it very much knows what it's done and where it's going, and it has different modes. The random mode is the most common mode, which is this random chaotic version of the dots, which I think gives you the best results because you really want randomness with fractional lasers. It tends to give you better, more reproducible results. It's very easy to hold. The handpiece is integrated with the Zimmer if you'd like it to be. And here's a little video. So it rolls back and forth. Now we're going to random mode from the easy mode, and then there's also a static mode. The static mode is a stamping mode, ideal if you want to treat small areas where you just want a lot of precision as far as where you're going to be. Let's say you have a little area, maybe a crow's foot or scars in particular. You can use the static mode and rotate the handpiece at 45 degrees so you have 3 different angles to get a nice even dispersion of the dots. And here that is on burn paper. You can see the different dots. The dynamic mode is rarely used. It's where they're spaced out evenly. Static mode, again, is nice if you have small areas for scars, periorbital, small fixed focal areas. The random mode is going to be the mode you're going to use most of the time, which is the primary mode. And there's also a CW mode, which just continues to fire. The nice thing about the random mode is it knows how fast the rollers are going. It compensates for that. So it has a nice way to be safe because as you move faster, it knows you're moving faster, and then it delivers the dots accordingly. So patients can be almost any skin type. We're looking for improvement in pigmentation, and that can include dyschromia, actinic damage, melasma, but also texture, pore size, and fine lines. And again, if you look at this ratio of improvement to downtime, this wavelength really delivers. Again, great for millennials. People are busy, particularly people who are in sales or other types of jobs where the recovery is very important, that they get back into action fast. And there's no bright light here. So unlike IPL, where people do tend to complain, particularly when you approach the upper part of the cheek about the bright light, there's no bright light. And more importantly, you don't have to worry about beard hair, which you do have to worry about with IPL. So you can rotate this or roll it over a man's freshly shaven beard area and not have any impact whatsoever on the hairs themselves. But what about IPL versus Ultra? So they're really fundamentally different. People oftentimes ask me that, and I have a little laptop. I show pictures of kind of how things work when I have a bedside chat with a patient or chairside chat. And water is the chromophore for thulium, not pigment. So that's one of the primary differences. So this laser is laying down the dots regardless of what kind of surface it's on. So it doesn't really know whether it's hitting a blood vessel or a normal skin or a brown spot. It's rolling across the skin and randomly delivering these spots. So it's not going to selectively target a brown spot. That means that sometimes it takes more treatments to get the whole brown spot. So if you rely on this just as a mono device or a monotherapy, you're going to have to do few sessions because you're not really going to do typically more than 50% of the skin's surface area with any ultra session. But the advantages of this beyond IPL is you get some improvement in fine lines and texture beyond the pigment problems. And it's safe for all skin types. So if you have type 4 skin or type 5 skin or using an IPL, oftentimes you're always approaching that danger zone. So when you elevate the settings on an IPL, particularly in say a darker Asian patient with a lentigo, the contrast between that lentigo and that background skin is oftentimes very small, and so you're oftentimes approaching that tough danger zone. This is relatively safe. As long as you maintain the number of dots and the density at a safe level, you're not going to have rebound hyperpigmentation, and you're not going to have issues with striping or overtreatment. IPL takes a summer vacation because when people become darker, again, the contrast between the background skin and the lesion becomes smaller, which increases the risk to the patient. And again, this is easy to use. You roll back and forth, back and forth. It is important to be safe with the eye, but the eye safety issues are certainly a little safer with this than with a traditional IPL. So here's some photographs. You see this before and after 4 treatments. And again, beyond the pigment that you see here, there's actually a smoothing of the skin. If you look very, very carefully, you see there is some smoothness of the skin that goes beyond the pigment. Likewise, this patient, this was just done with the Ultra, no additional devices. Now, you could have used the Spectre device, for example, one of Lutronics Q-switch lasers at 532 nanometers. You could have pre-treated the focal pigment lesions and then come back with the Ultra. And, of course, you could have gotten to the same point probably with 2 treatments versus 4 treatments. So, again, you can cleverly combine different technologies to get even better results than one device alone with less treatments. It really depends on what you have in your kind of your stable of lasers and what patients are willing to pay for and what they're willing to tolerate from a pain perspective. Here's another. This is an Asian patient. This would be a tough patient for IPL. You certainly could treat with IPL or visible light technology, but this is a safer way to go, just using the Ultra back and forth, because again, it really is randomly treating the skin. And if you look at her skin, not only is the pigment better, but there's a glow to her skin after the treatment that you didn't see before the treatment, which is very important. So you really can design a patient experience that's customized with this device. Again, the first thing, have your consultation with the patient, talk about different approaches to whatever the patient's coming in with. But I can tell you that 70% of our patients in San Diego have some pigment disturbance, and it's probably the single most common reason we see patients, even more than blood vessels and wrinkles, is color. And some patients, frankly, they care about their wrinkles, but they really care more about their lentigines, freckles, and melasma, which is always very interesting to me. So you discuss the regimen, then you just set the parameters and use some numbing cream, cold air, and you're there. And there are some options with this device. Lutronic has come up with some different accessories to the device. One is a cooling mask, which is optional, and have some serum ampules you can apply during the point of the treatment. So these are the ampule series, and there are 4 different ones. They're actually shaken up by a built-in blender-like device, and they are ascorbic acid or vitamin C, retinol, tranexamic acid for pigment, and resveratrol for pigment as well. And these can be applied right after the session. And they've been very, very well designed, chemically free of a lot of the things that typically irritate patients. So this is a way to complement and turbocharge the results from the ultra treatment itself. And so the ampule preparation, again, it has a little vibrating machine that shakes up the compounds, and they're applied after the treatment along with a cooling mask if you so choose. And that's really the experience aftercare, the ultra experience aftercare, which is, again, the nourishing mask, which is very nice. Patients like that. It takes away that immediate sunburn sensation that almost everybody encounters after a fractional laser procedure. And so what about prices? Well, the prices largely depend on probably who does the procedure, where it's done as far as geography, and whether you give the accessories. So if you do the cooling mask and the ampules, you would charge more. If you just do the treatment alone, you would charge less. And again, oftentimes you may add fillers and neuromodulators, of course, which they would pay extra for, and even some other devices. So it really depends largely on what you're doing, how you're doing it, how much time it takes, and what your market will bear. But a typical fee might be $500 to $800 for one treatment for the ultra alone, and if you add the experience package, a bit more. So that's the painting of the house, and oftentimes that's all that patients really need. If you have a younger patient, they're going to have some pigment dyschromia even as early as 20 or 25, depending on where they're brought up or where they're raised and how much outdoor activities they participate in. Now we're talking about the foundation work. What about the lifting, the laxity, the jowling, and the Venetian blind type lines on the neck and face? How do we reverse that and complement the ultra system? Well, that takes us to the Genius. And it's called Genius because of intelligent radio frequency delivery, and we'll talk about why that is. So I'm going to show two pictures here. We'll show the first picture to your left is a woman in her 50s. I'm going to pinch the skin. If you look to your left, you see if we pinch that skin, it's going to take a little while for that skin to snap back. On the left, we'll watch it. See, it's taking a while to snap back. And then we go to the right, and you'll see a younger person, about 13 years old, and the skin snaps back right away. And this is really the difference between 55-year-old skin and 15-year-old skin, is this elasticity. So as you get older, you lose that elasticity. And likewise, in addition to seeing that, if you actually take your chin and bring it toward your chest, you'll notice somebody who's 12 or 13, the skin doesn't bundle up. But somebody who's 45, 55, and 65, the skin tends to bundle up, which makes people want to walk around all day long with their chin up. Because if you're 55 and you bring your chin down reading a book, the skin's going to bundle up. So what we want to do with the Genius is restore that elasticity that we've lost. And this is the typical presentation on the next slide that I see patients coming with. This is a 45-year-old lady with actually reasonably good skin. She does have some pigmentation abnormalities. Certainly that could be addressed with the Ultra. But she's really more concerned with this early jowl. And when she brings her chin to her chest, it becomes more apparent. And she also has this little V-necked notch, which is just in front of the jowl, just in front of the arrow. And so oftentimes we'll take a little filler and place that in that pre-jowl so-called sulcus, but we'll also need something to tighten the skin. And that's where the Genius really comes in. It's a 1-2 punch. Pigment with the Ultra and some tightening with the Genius. Some things the Genius is not good for. A patient like this who has very deep lines but a lot of superficial sun damage, even with the Ultra and the Genius, you can only do so much. If you look at this next slide, you'll see this is a biopsy we did actually with the Genius. You see this zone of thermal damage, which is about 500 microns down where the arrow is, where it says wrinkles come from here. That's a cerulolastosis. There's a little coagulation below that. But you see in this case we're bypassing the cerulolastosis. For this type of patient to get a really wow result, you would need to do a very aggressive CO2 laser. So a patient like this would not be treated well by any kind of deep tightening device. So the potential benefits of delivering radiofrequency via microneedles are the following. Well, first of all, you can bypass the epidermis, particularly with insulated needles, if you desire. And since you have the Ultra to address the epidermis, it really plays into this hand right here. These coagulation zones produce both things, collagen and elastin remodeling. And you can set the depth and the density to whatever you want. Again, the titration of this is very nice. You can do very gentle sessions where you just use a numbing cream and cold air, or you can do more aggressive device settings where you use some injectable anesthesia and maybe get better results with a little bit more downtime as far as swelling. How RF microneedling works, you have these 49 needles that go into the skin simultaneously in the case of the Genius, and as it goes down, it's delivering a power, and that's going to be converted into heat based on the resistance, the local resistance at the needle tip. And that temperature will raise well over 65 degrees and cause heating in a very controlled way. and that in turn starts in the process of skin rehabilitation and regeneration, which will result in new elastin and new collagen production. On the left, we see a view of a non-ablative fractional laser, the middle an ablative fractional laser, and then we have the precision radiofrequency of the Genius. We have relative sparing of the epidermis, and you have these zones that are set up where you have these little voxels of injury that are delivered based on the time, power, and the depth of the tip. So there are a lot of issues with radiofrequency microneedling, and if you look at any aesthetic buyer's guide or any type of guide, there are lots of different devices out there for radiofrequency microneedling. And the problem is a lot of people look at that and say, well, why does it matter? They all seem to do the same thing. They all seem to go to about 3 millimeters. They all seem to have 25 to 50 needles. They're insulated. They're not insulated. Why would I purchase the Genius versus some other brand? Well, there are a few different things. One is the needle depth. We don't know where the needles are going with many of these devices. There hasn't been a lot of thought as far as the resistance of the needles to the skin. The skin does not like to let things in. Sharpness, design, and size of the needles, and then comfort is oftentimes weaved into the structure of the pulses and the needle design and the sharpness of the needle. So you really can't say that every radiofrequency microneedling device is just like the other, despite what they may say on the settings on the device as far as the specs. So the Genius, again, brings the intelligence of the provider and technology in every treatment because it allows you to customize the treatments, and it gives you feedback as to whether you're delivering the energy the way you want to. The needles are delivered smoothly and consistently to the right depth, and you can set it for each patient to titrate and customize a treatment algorithm to get the best results with the least downtime. The key things for this are the exact needle insertion, the measured delivered energy, validated protocols, and provide real-time feedback of pulse delivery. So how do you accomplish this in true 3D fractional? Well, the accuracy, impedance control, and intelligence. So let's look at the needles. So if you look at the competitive needles on the left, they're a little rough, and with more insertions, they become fatigued. The Genius was designed with sharpness, continual bevel, and smoothness. And these videos are very instructive. If we go to the left, you'll see a video of the Genius. You see the needles are going in relatively unimpeded. They're not moving the gel substrate. You go to the second device, and you'll notice that when this device goes in, the needles are going in, but they're actually pushing the substrate away. And this is what happens with the skin. So the middle of the insertion stamp, the needle is actually pushing the skin away. And so that means you don't have good needle insertion. You go to a third device and a similar type of picture. So the elegance that's related to the needle sharpness and also the force of the device as far as pushing the needles in is really what matters. A lot of thought went into the design of the Genius to make sure the needles went in to full insertion every time. What about insulated versus non-insulated? So the left you have a non-insulated needle. We have some damage to the epidermis. On the right you see the Genius is sparing the epidermis, which will decrease the risk of post-inflammatory hyperpigmentation. But impedance control is really the differentiator with this device. This device knows what the resistance is or the impedance at any given time. And if you deliver the energy too fast with other devices, what happens is the device stops delivering energy. So it doesn't hurt as much, and you would say it says it's delivering all this power, but in fact, it's really not doing what it says. With impedance control, the energy delivery is constant and fluid because the device is monitoring the power and the voltage to make sure all the energy is delivered so you get your full complement of energy. So if you look at this graph, you see the actual power versus requested power. So if you look at the device on the lower side, this yellow line, you see it says 75 watts. That's what it says on the display, but it's only actually delivering 5 watts. So a lot of devices say they're delivering 40, 50, 60 watts, but in fact, because of the limitations of the impedance control and the feedback, they're really only delivering a fifth or a sixth of that. You look at the Genius curve, it's right on. So it says it's delivering 10 watts, you get 10 watts, 20 watts, 20 watts, 30 watts. So in that case, you're getting an entire complement of the energy. So these are real wounds that create real collagen changes, real elastic changes. Some of these other wounds are very small. Here's a typical result. On the left is the Genius, delivering real therapeutically helpful wounds. On the right, it's uncontrolled, imprecise energy delivery, which is going to result in, yes, less pain because the coagulation zones are smaller, but less improvement. Here's a device being used back and forth. It's very fast, 300 or 400 milliseconds per pulse. You can actually do longer pulses, particularly if you're doing deeper heating, and it's reasonably comfortable. You have to at least use numbing cream and cold air for most patients. Some patients can do okay without that. It's a very fast procedure, though. Here's some typical clinical results. This is one of my patients before and after. And if you look at the cheek, particularly the cheek here, you see some tightening of the skin, and on the neck as well. Here's some acne scars from Dr. Ibrahimi, which have been improved. This is after one treatment. Here's one of our steady patients, and you see it right lateral to the mesolabial fold. This is improvement here. And again, we're delivering a lot of heat here. Heat is the key. And people oftentimes ask, well, what about microneedling alone? Without heat, can you get this? No, you can't. You have to have something beyond just standard microneedling to achieve these results. And this is the jowl we talked about before along the jowl line, tightening up that jowl line, which is what a lot of young women want. Before and after, again, just some tightening of the skin in the submental area. This is my own patients, one treatment, no fillers, no other treatment. Again, a lot of women really hate these lines along the cheek, and what this does, it tightens up those lines a bit. This is after one treatment, and with additional treatments, you would get better results. And again, you can combine this with the Ultra to get that skin smoothing effect and that skin pigmenting improvement effect. Acne scars again, you see before and after, it really can improve acne scars. This is after 2 treatments with the Genius. And then finally, the TotalSkin solution is doing both. And this combines the Ultra and the volumizing and lifting effect of the Genius. So this way you get pigment control, collagen, elastin, all in one fell swoop. And this is the combination. So you see the deeper wounds being created with the Genius, and then the more superficial wounds with the Laze MD Ultra. So you're getting that top to bottom effect, catching all the layers of the skin. So generally, you use the Genius first and Laze MD second. You certainly could do it in the other order. Genius settings, you go from light to intense, and again, the 4 to 8 passes of the Ultra are tolerated easily. You can do different modes to get the best results with the least downtime. Here's another video showing briefly the different effects. This is the Genius part. You'll see some white areas where the Genius was not used. And again, when you go back with the Ultra on the same area, you will have the opportunity to see that all become kind of red. You'll get this nice, very light crusting effect with the Ultra laser all in the same time. And here's the total skin solution with the Ultra. Now you can go back and forth. We generally go back and forth in the same line as 1 and 2 passes, or you can go across and move. So it really depends on your individual style. As long as that light stays red, you're not going too fast for the laser. Now here's the recovery. This is immediately after. This is combined Ultra and Genius, and you see it's a pretty easy recovery. If you use more aggressive settings, you may get more redness, a little bit more crusting. And that's the total skin solution, some before and afters. This is a patient before and after. You see the pigment is much improved, particularly if you look at the forehead. Improvement in tone and texture. This is after 1 treatment. This, again, 2 treatments around the eyes. You see the improvement in the pigment, tone, and texture. Same thing here, 2 treatments. Here's a lady who had some improvement in the jowling and the neck with a combination of Genius and Laze MD. Acne scars again. After 3 treatments, you see improvement in the depth of the scars. Again, very tolerant to different pigments. And finally, this is my own patients. Now, I only used 1 syringe of filler here, and so 1 syringe of filler would not have done all this. I did it between both sides, and this is just one side. So what I did is I just did the filler mainly along the mesobial folds and merit lines. But look what this one treatment did to the skin on the mid-cheek area. This is Genius done fairly aggressively. I was at very aggressive settings. I did use some anesthesia, tumescent style with this, but these are the types of results you can get, and I combined this with 1927. So you get this nice polishing of the skin and improvement in the foundation of the skin, and all in one treatment. So we're ready for some questions now. Do we have any questions?
Yeah, that's fantastic. Thank you for that walkthrough. It's great to see, you know, instead of just using products as they're cleared by the FDA, combining them together to meet whatever the patient's needs are. I love your Batman utility reference. That's fantastic. A couple of questions I had. First one is, how does stacking these treatments together affect the overall recovery period for the patient?
Well, it does make the recovery a little longer. If you saw that 5 series of pictures there and that one lady, if you do the Ultra and the Genius at the same time, you'll have a bit more downtime. But it's just a day or 2 more downtime, so it's not going to really change the recovery that much. You could add other devices to your soup as well, and neuromodulators and fillers. So the more things you stack, the greater the recovery, but not a whole lot more recovery. If you do the Ultra and the Genius together, I'd say you add a day or 2 more downtime than either one alone.
All right, there's a bunch of questions that came in, but I have one more. So in summary, who would be the best candidate for TotalSkin? And basically, when you're meeting that patient, you're trying to set their expectations. How do you set their expectations for how many treatments they might need?
Well, it largely depends on the age and the presentation of the patient. If somebody is on the younger side, say 35 to 45, and they're not very photo damaged, you might get by with one treatment or at the most two, spaced 6 to 8 weeks apart. And what you're really focusing in on is what these devices do best, which is the pigment and fine lines for the Ultra, and a little bit of firming of the skin for the Genius. And what we oftentimes do is we just do the Genius sometimes on the cheeks and the middle of the face, and not always the entire face, because sometimes we'll get really nice results doing that and not have to spend as much time doing, say, the forehead, where oftentimes neuromodulators are better for lines up in there. So we really try to craft a strategy that's best for the patient and the physician, because we want to get the best results with the least downtime for the patient and ourselves, because these numbing medicines wear off. So if you're going to just rely on numbing creams, for example, time is your enemy in a sense. So you want to do these therapies relatively briskly and use the devices where they're best going to be deployed to get the best results. So where somebody has a lot of pigment, we use more of the Ultra. More firming, we use more of the Genius.
All right, we have a couple of questions coming in on the chat. That's a good one here. Getting patients to return for a series is a challenge. How do you get patients to come back? What's the hook?
So the hook first is the Ultra, because the Ultra right off the bat is going to give you a smoothing effect and a light, not so much crusting, but a light peeling effect. So if you do the Ultra in the first session and combine it with the Genius or the Ultra alone, that really hooks the patient in, because they see something in 4 or 5 days that's undeniably better. You could look at a picture and it's going to be better. Even if they don't have a lot of pigment, they're going to look better. So that hooks them in. You really have to rely on the superficial procedures first, because any deep heating device, whether it's ultrasound, microneedling, is going to rely partly on time. And time is a bit of your enemy here, because patients don't like to wait. We're in an age where everybody has a smartphone. They want answers right away. They want improvement right away. So waiting a month or two to see the results from the Genius is oftentimes not something patients are going to be willing to tolerate. So the key thing in hooking them is to get that Ultra in early, get the superficial things better, and then they'll see the Genius kick in, and they're ready for that second treatment. And now they're engaged and they're enthusiastic.
I think that's critical for these inpatient patients. They want to see results right away, especially the younger patients. So I liked your comment earlier about using a filler as well, because in some cases they leave and they immediately see some change. So they're willing to stick around and have the confidence to wait for the collagen remodeling and elastin that takes several months.
Exactly.
Okay, we've got some really great questions about some curveballs at you. All right, so TotalSkin for darker skin types and melasma. So maybe you could talk a little bit about how you might curb your therapy for darker skin types, and then melasma, as we all know, that's a challenge. So I'm interested to hear what your thoughts are there.
Well, darker skin in itself with the Genius is not an issue. They do get, when the wounds heal, you'll see more dots, they're brown dots, but just because the superficial crust come off, so it's not really hyperpigmentation. So that's not an issue for firming. So for firming with the Genius, the skin type is not, particularly with the insulated needles, not a big issue. As far as pigment restoration, pigment rehabilitation, static pigmentation, which is hyperpigmentation like lentiginous, no problems with the Ultra. You can use it all day long. Now, melasma is a different animal, because melasma is really a dynamic condition. It's a reactive condition, and it has various components. It has a pigment component, probably a vascular component, and even a neurogenic component. So melasma tends to be like high blood pressure or diabetes, in the sense it's a chronic condition. And the best we can hope for is control. And when you talk about control, you mean you're bringing all weapons to bear in a very gentle way to rehabilitate and remodel and reprogram the skin. So oftentimes we prime the skin with hydroquinone and or retin-A before the treatment. And then we oftentimes will do a treatment with the Ultra with very conservative settings, say 5 millijoules and about 10% density. And then we'll follow it up with a potent topical steroid for about 5 to 10 days after the treatment, and then rapidly deploy the hydroquinone and retinoids after that to try to suppress PIH. If you do that a number of times and you're careful about the sun, you can use this device very safely and elegantly to improve the skin. If you overtreat or you don't really sell the whole package in the sense of all the ingredients, which is the post-care, the pre-care, you can have rebound hyperpigmentation like any other melasma therapy.
Great. So we have some commercial questions. So how much extra would you charge for the combination treatment as opposed to the standalone treatments? Is there kind of a percentage you use that you think about that?
Yeah, so normally what we would do is we kind of divide it up in sort of the superficial part and the deeper part. So the Genius being the deeper part. It's rare that we would do the Genius alone, like completely alone, because most patients who have skin laxity issues also have pigment issues and very fine line issues. So we oftentimes add the Genius more than add the Ultra. So let's say we start with the Ultra and then we add the Genius. And again, I oftentimes add the Genius really strategically in two main areas, the lower face and the neck. And what we'll do for the neck, let's say we're doing Ultra on the neck and it was $500, we'll add another $400 for the Genius. And likewise for the face, we would do a total treatment for about $1,250. That would be the Ultra for the face, and then the Genius strategically placed normally on the mid-face and cheek area.
Thanks for that. And then there was some questions about just managing pain. I think you mentioned earlier, maybe you can just recap that about topicals or cooling. How do you manage the pain with either system, and does it change when they're combined?
Yeah, well, the pain is manageable if you do the procedure relatively briskly with just cold air and numbing cream. In one way you can strategically do that. Let's say the patient is completely averse to any kind of shots. There are some people who are needle phobic and they don't want any kind of injection. You have to take off the cream segmentally, because if you do combined therapy, meaning the Genius and the Ultra, very few people could get through that whole procedure from the clavicle to the hairline with Genius and Ultra, because it's just too long. So you would have to take it off segmentally or add injectable. So if the patient's particularly tough, you can do strategic segmental removal of the cream, like start on the forehead, do the Ultra and the Genius, then take it off the cheek, do the Ultra and the Genius, then the other cheek, then the neck, etc. And if patients are somewhat tough with the cold air, particularly with the numbing cream alone, they can get through it. When you start to do higher levels with the Genius, meaning long times as far as the pulse duration and higher powers without desiccation, you'll start to run into some heat pain, and you almost have to deploy some injectable anesthesia, I found. And we do that with these mesoram needles, which are these sprinkler system needles, which will deploy strategically along the neck and the lower face. And although it sounds like it's rough, it really isn't that rough. And the nice thing about using the needles is the patients get really complete relief from pain, which means you go unimpeded. You don't really change the way you're acting based on the patient wincing. And secondly, they get some postoperative pain relief from the Ultra, which tends to cause this lingering heat pain just for about 20 or 30 minutes. So we don't really discourage the use of the injectables if we're doing particularly patients who are older, who I think require more from the Genius. We're very liberal about using injectable anesthesia. We buffer it so it's not that painful. So the buffering is very important with bicarbonate for the lidocaine solution. And you do get a little swelling with the lidocaine and occasionally get a little bruise from the needles. But I think the benefits outweigh the risk for most patients. Now, if it's a very young patient and you can take off the cream segmentally, you can certainly do the whole case with just a topical anesthesia and the cold air. And, as dermatologists, we're pretty impatient. We really don't like procedures to take more than 15 to 30 minutes. So I like to do things relatively briskly so everything's ready to go, and there's very little downtime in the sense of stopping. So it really is a symphony, and you have to get the symphony running so everything is running smoothly.
That's great. Well, that was a lot of questions. There's one more. I think we just could fit this in. I got a bunch of questions about needles. Maybe you could just generally talk about what you look at when it comes to needle design rather than trying to address all the individual questions. What's unique here?
Well, uniqueness is the sharpness of the needles and the robustness of the needles and the strength of the needles and the durability of the needles. So we have taken this device through 1,000, 1,500 pulses without any identifiable needle fatigue, which typically you would see with some other systems because the needles increasingly push the skin away, which means they're not being inserted firmly and completely. So the needle design here was, and just as the photograph we showed about 30 slides ago, it really is set up to deliver the needles in a more painless fashion and a more reproducible fashion. If the needles aren't going where they say they're going, everything else is suspect. So if you say you're going to 2.8 millimeter depth on your panel, regardless of the system you're using, and the needles are only going down 1.7 millimeters, well, then all bets are off. You really don't know what you're delivering. So the nice thing about the Genius, it was set up to be able to deliver those needles as deeply as you possibly can on every insertion, and more importantly, give you feedback if the full complement of energy is not delivered, and that gives you some tips as to what you could do to make your next pulses better.
Okay, well, listen, that was very comprehensive. I believe wholeheartedly in a holistic approach, and obviously you do as well. I want to thank you for your time going through all this presentation. That was more time than we expected, and there was plenty of questions here.
Well, thank you very much.
Thank you for attending our virtual workshop today. If you have any additional questions or would like additional information, please send an email to info@lutronic-usa.com. Thank you and goodbye.